welcome you all to today's session. Myself Rajita, and in today's session, we are going to discuss about an important topic. Now, this topic comes into the basic of medical surgical nursing. So, what I mean to say is, before going to discuss about the disease condition, the management and treatment of this disease condition, nursing responsibilities to provide care to this patient, before discussing those parts, we should definitely have a clear idea regarding the basic concept of the health, disease, and illness. So basically, it is a continuation of those sessions where we have discussed regarding the concept of health. And one more session we have where we have discussed regarding the concept of disease. Like through this session, I hope you have now a clear idea what you mean by health, what you mean by disease. What are the factors which is influencing the health and causing the disease process to occur in the individual body? Now, in those sessions, we have also discussed regarding the differentiation between disease, illness, and sickness. So today, we are going to learn about the concept of illness. So let's get started with the topic today. So in this session of concept of illness, we're going to discuss about the definition of illness, the variables of illness. That is basically, you can say, we will be discussing the internal and external variables that are the factors which are associated with the illness process. Next, we are going to discuss regarding the stages of illness response. Next, we are going to discuss regarding the impact of illness on the individual. And at last, we will be discussing regarding certain terminologies related to the illness, that is acute, terminal, and chronic illness. So as we will be heading towards the terminologies, first, we should learn the basic concept of illness. What do you mean by illness? Already we have learned that the disease is basically the presence of signs and symptoms when there is development of pathological changes which is affecting the individual body. Now, if it shows or it presents with some signs and symptoms, definitely a person tends to behave in a certain way towards that disease process. That is, in a simple term, is known as illness. So here, first we are going to discuss about the definition of illness. So first, we are going to learn about the definition of illness. It states that illness is basically a condition which is characterized by the deviation from a normal health state, which is manifested with certain physical and psychological symptom. I hope you are clear that this is basically a condition which is suggesting that or characterized by the deviation from the normal health. We already have learned what is health. We have seen if an individual is maintaining the harmonization within oneself and with the external and internal environment, they're maintaining physical, psychological, psychosocial, and environmental well-being. We can call that particular individual as a healthy person, right? Now, once there is any slight deviation from the well-being state, we're going to see the person may show with certain signs and symptoms. Now, here, this state where they're present with deviated signs and symptoms, we're going to call this state as illness. So for your understanding, I will be stating an example so that you will be having a clear idea. Now, we all know that we are definitely maintain adjustment towards our environment, right? In all our life, we have a certain amount of stress, but in the normal physiological mechanism, our individual being is capable enough to maintain the stress which is present into their external environment, and we are capable enough to adjust with the stress and live a smooth life. Now, in case if there is a individual, suppose, who is having a huge amount of stress in their external environment, and due to certain reason, due to their inner self, they are not able to cope up with the external stress, or we can say they are not able to adjust the external stress. Here, the person more likely to show the symptoms like anxiety, depression, and also they will be having a negative feeling towards themselves or towards their life. Here, basically, when a person is present with such symptoms where they are showing anxiety, they are showing the symptoms of depression, it suggests that they are deviated from the normal health state. And this stage, we're going to call it as they are having certain abnormalities, which we also can term as illness. So the next definition of illness states that illness is a state in which a person's physical, intellectual, emotional, and social or spiritual functioning is diminished, or these functions are impaired in comparison with the previous experience. What is meant to say is, once a person was maintaining a normal functioning, that is physical, psychosocial, and also the intellectual and psychological functioning, but here, due to certain reason, if there is any alteration in that, where they are not able to maintain the adequate functional level of them, then we are going to call this state as the illness state. So I hope you're now clear about the concept of illness, and also we have learned regarding the definition of illness. So now we are going to discuss about the next topic associated with illness, that is the variables which are affecting the illness behavior. Here, basically, the variables are classified into two different categories. Now, these two different categories of variables generally affect the illness behavior of an individual. Now, we all know that a person or an individual person, when they are going through certain alteration into their physiological or psychological or social or intellectual functioning, they will definitely show a certain amount of specific behavior towards the illness process. Now here we are just going to read about what are the basic variables or factors that decides that how an individual is going to react towards the illness process. So as I have told that these variables or factors are classified under two broad classification. The first one is known as the internal variables. The next one is known as the external variables. Here, we are going to read about the internal variables first. So, internal variables, which basically are the factors or the variables which are specifically present in oneself, and these are the individualized factor which influence their illness behavior. So the internal variables are basically categorized into three different points. The first one is the perception of the illness. So here we're going to read in details that how individuals' perception basically influence their illness behavior. The second internal variables is the nature of illness. Definitely, what a person is going through or what is the basic nature of their disease, that is also decide how a person would behave towards their illness. The next point is the characteristics of a person. So as we know, different individuals have different characteristics. Now, some people will be so much positive towards their life. Some people will be having certain negative feelings towards their life. Now, the characteristics of person also basically decide how a person would behave towards their illness. So that's how this three particular point, that is the perception of the disease, the nature of illness which is affecting the individual, and the characteristics of a particular person decides the illness behavior. So first we are going to discuss about the perception of symptoms of an individual, how it is going to affect the illness behavior. So the perception of symptoms is basically depends on how individual is perceiving their illness. So suppose if a client is present with a very severe disease, but they are so panic stricken or so anxious about the disease process, they will soon lose their hope to survive, and that is when the disease process is more likely to exaggerate, right? And they will also more of the most of the time they will also not be very okay to suggest or to take the suggestion or to consult the doctor, because they will be already having a negative feeling towards their life that they have developed with a very severe disease which cannot be cured, and it this feelings is more likely to increase the disease progression. Whereas suppose the same disease have occurred to another individual where he is very strong in nature and he have a very perfect and positive outlook towards his life, what he will be doing, he will try to analyze what are the problem he's facing, and they will be definitely going to take some suggestion from physicians, or they will try to consult the medical professionals in order to get the treatment done. Because of this positive outlook, sometimes we will be able to see the disease progression is very slow, or we even can see the curation rate of those particular individual is higher than those people who are having negative outlook towards the treatment procedure. Basically it suggests or it helps us to decide that depending on our belief and depending on our perception of the symptoms and illness also affect the illness progression or disease progression for a particular individual. So definitely we are going to see this particular variables, that is the person of symptoms, also influence the disease progression or helps to cope up with the certain changes which has been taken place in the individual's body due to the pathological process. The next factor is the nature of illness. So this variable is very important because definitely depending on what kind of disease a person is having, always the illness behavior will change according to it. For example, suppose we are taking two person here, the person A and person B. So suppose a person A have developed a mild infection. The symptoms which are present is just a mild fever and fatigue and anorexia. Now, they will not be having a fear of death, or they won't be having a fear of very anxiety, right? If they are going to ask for a treatment with mild treatment also, they will be able to see the changes or see the improvement in their health. Whereas suppose the person we have developed with a certain malignancy, for say liver cancer or malignancy of liver. Now with this particular term or the nature of disease here is so complicated that definitely it provides a very negative feeling for the particular individual who is diagnosed with this certain kind of disease condition, right? So that's how the nature of illness or what is the basic disease is present or have developed to a certain individual. Depending on the nature of disease also our illness behavior changes. So this is also a very important internal variables which decides our illness behavior. The next is the characteristics of an individual. Now, definitely it depends on or it varies from person to person, because we all know that all of ourselves are different from each other, right? Now, definitely the characteristics of individual helps or decides the illness behavior of that particular individual. Now, it depends on our adjusting power or coping abilities, and also our outlook towards the life. Now, many of the individual may have a higher coping power who will be able to adjust themselves with the changes which is occurring. Now, certain individual will not be having the coping power enough where they will be mentally disturbed due to the disease process. Now, once a person is developing certain anxiety or depression, they're more likely to have a high-paced disease progression. So I hope you are understanding here, definitely depending on the characteristics of individual, how the individual is looking towards his life, how the individual is taking the changes which is occurring because of the pathological process, how they are coping or trying to adjust with the changes, that also basically decide the illness behavior. So I hope till here you are completely clear about the internal variables that may affect the illness behavior, which definitely consisting of the perception of the symptoms, nature of illness, and third is the characteristics of individual being. Next, we are going to discuss regarding the external variables which affects the illness behavior. Now, external variables also influence the illness behavior. External variables include of symptoms, social group, culture and values, economical condition or economical state, as well as accessibility to the healthcare. So basically, these five are the most important external variable which influence the illness behavior. So we are going to read one by one about this external variables in detail, how it is going to influence the illness behavior of an individual. So first we are going to read about the first external variables, that is visibility of the symptoms. Now it has been seen that a client who is present with visible symptoms, which is basically changing their body image, those individuals who are present with these visible symptoms are more likely to seek more attention and assistance in order to get cured from this particular disease. Now, visibility of symptoms, if it is present for an individual, they are more likely to have a negative feeling and they are more likely to suffer from anxiety and depressions, because here definitely the body image will change and definitely their social appearance will also change. That is the reason why visibility of symptoms, if it is present, definitely it's basically increase the complexity of the disease process. Now, for example, a person who is present with a oral cancer or who have got changes into their facial place or they have got changes into their mouth. So this will be more visible rather than present of liver cancer, right? Although the both of the disease process is very complex, their treatment procedure is very complex, but a person who is suffering from the liver cancer is not more likely to show any symptoms which is present or which is changing the body image at once. But a person who is suffering from oral cancer may go under many changes which is occurring into their face and their body, right? So that is the reason why a person who is suffering from facial cancer or oral cancer, they're more likely to suffer from disturbed body image and they will be having the feeling of some loss of self-worth, and they will be also very anxious and disturbed in mentally. Whereas a person who is suffering from liver cancer, although they will be also having difficulties because they will be having so much severe signs and symptoms, but here as there is no certain changes into the body image is taking place, for them it is more easy to get cope with the changes, right? Because these are only the pain they're suffering from, but here the person is suffering from the same kind of pain, but also they're having a visible changes into their body image that is also create or increase the more complexity into the disease process. That's how the visibility of symptoms also basically affects the illness behavior of an individual. Now, for example, if a person is suffering from a very mild burn, right? Suppose the mild burn has taken place only to the hand or upper extremities, they are more likely to suffer from pain, but their mental stress will be lesser than a person who is suffering from a severe burn, right? Because their body image will be completely changed here. So definitely, depending on the visibility of symptoms or the severity of symptoms which is visible, that also helps to decide the illness behavior for an individual person. Next, we are going to read about the social group in which the individual is belongs to. Also, basically decide the illness behavior for a particular individual. Now, social group is a very important part when it comes to disease process for a particular individual. Now, here the client will be responding towards the disease process depending on how much social support they are getting. Now, social support group where they are getting an idea regarding the nature of disease, where they're getting the mental support from a person who have maybe battling the same war, also helps to boost their self-confidence. That's how the social group or social support also helps to decide the illness behavior for an individual being. A person who doesn't have a social support when he or she is suffering from a severe disease is more having difficulties to cope up with the changes that is occurring in their life due to the pathological process. But whereas a person who is having a solid social support, they are more likely to cope with the changes easily due to the pathological process. So that's how the social support and the presence of social group also influence the illness behavior for a particular individual. Next, we are going to learn regarding the cultural variables which also influence the illness behavior of an individual. Now, it has been seen even the culture, values, and belief and practices also helps the particular individual to remain healthy and maintain a healthy state for a prolonged time. Also, it helps our individual to recognize the illness in certain way. Definitely depends on our culture, we basically respond towards the illness. So how we are brought up from the childhood, what are our beliefs, what are our practices, also helps to decide the illness behavior towards an disease process. So now, definitely we see, depending on the individual's culture and their values, beliefs, also decides how the individual is going to recognize the illness, how they are gonna, behave towards the illness. Now, if a person, it is say that if a person is spiritually strong, they might have more chances to cope with the changes that they are going through or that is taking place because of the pathological process. Whereas a person, if they are not having a strong spiritual health, they are more likely to complain regarding the changes, and they're not more likely to not be able to cope with the changes that is taking place due to the disease process. That's how our culture and belief also decides our illness behavior. So next we are going to discuss regarding the economical variables. It is a very important point when it comes to the treatment and illness behavior, because it has been noted that a person who is present in a lower socioeconomic class, they will be having more difficulties to cope with the illness, or they will be having more negative feeling towards the illness behavior or illness process because of the economic stress. Because we all know, if a disease process is occurring, that needs to have a continuous monitoring, regular diagnostic studies, and definitely should get a treatment done at a regular interval. Now, a person who belongs to a lower socioeconomic class, they will suffer more issues when comes to the disease process and their treatment. So that's the reason they will be having more negative outlook toward the disease process and the treatment. Whereas if a person is economically stable, they will more likely to seek for the medical treatment at right time, and they will also get the treatment done so that they will show the improvement in their health with the treatment. That's how the economical variable basically helps to decide the illness behavior. The next variable is the accessibility of the health services. Here we are going to see, depending on the accessibility of the health services, also individuals' illness behavior will change. The proximity of the health services has great influence on individual, and how they're going to use it also depends on that. So basically, if an individual who is having very easy access to the healthcare, they are more likely to behave towards an illness if it is occurring with a positive manner, because they will be able to get the treatment done at a right time. But whereas if a person is having difficult access towards the healthcare setup or towards the treatment procedure, they are more likely to suffer from negative behavior towards the illness process, because they will be going through lots of challenges when they are basically seeking the medical treatment to cure the disease process. That's how the accessibility of the health services also decides the illness behavior. So I hope till here you are completely learned regarding the internal and external variables, which are basically the internal and external factors which are basically influencing influencing the disease process and illness behavior. So I hope you understood that these are the factors which basically influence the individual to behave in a certain way towards the disease process. Now, once we have learned about this, next we are definitely gonna read regarding the stages of illness behavior. Now, the experience of illness is complex. We all know that. No matter how or what kind of disease it is, this process or the experience of the illness is always complex. A person will go through so many physical, psychological, social, economical problem while going through a illness process. Now, generally, we're going to see the person will be generally passes through 5 different stages of illness behavior. Now, this pattern or the stages of illness basically depends on how a person seek, find, and completes the health care when they are having a disease process occurred. Basically depends on how a person is looking towards signs and symptoms, how they're recognizing the disease, and how soon they are seeking the medical treatment done. So that's how we are going to see the person or an individual person, if they're diagnosed with a certain disease process, will be going through 5 stages of illness behavior. So here now we are going to read about these 5 stages of illness behavior one by one. So first is the stage 1, which is the stage of symptom experience. The second stage is known as the assumption of seek role. The third stage is known as the medical care contact, whereas the fourth stage is known as the dependent client care. The fifth stage is known as recovery and rehabilitation. I'll repeat once again. Here are 5 stages of illness behavior. The first stage is known as the stages of symptoms experience. The second stage is known as assumption of seek role. The third stage is known as the stage of medical care contact. The fourth stage is known as dependent client care, whereas the fifth stage is known as the rehabilitation and recovery stage. Now, we are going to read in detail regarding each one of the stage of illness behavior. So first is the stage 1, that is the stage of symptoms experience. So initially of this stage, our client, although they will be recognizing that there are certain changes has been taken place, but they will not be very sure, or they will be not be very having a very clear idea regarding what's wrong with them. So here the person would be understanding that they are having certain changes, maybe into their physical changes, maybe into their psychological process, but they will be not be able to recognize it properly. Whereas at the end of this stage of symptoms experience, a client will be able to identify clearly what are the changes has been taken place. So for example, a client may present with the pain at a certain location, or maybe the client will be understanding that they have developed with certain abnormal lump in a particular region of their body, or they will be understanding maybe that they will be having certain continuously present of symptoms, like maybe certain bleeding, or severe and horrible anorexia or loss of appetite. So that's how we are going to see that basically here in this stage of symptoms experience, a client will be understanding at the end of the stage that what are basically they're experiencing, and they will be understand that this particular changes are taking place due to certain pathological process only. So the stage of 2, that is known as the assumption of seek role. Here, the client, if the symptoms are or sign and symptoms are prominently present, the client will be definitely try to manage on their own self, because every individual who is present with the minimal sign and symptoms, they will be following certain practices so that they will be able to get rid of the symptoms. Now, even if the person have done it, but still if the signs and symptoms are continuously present on an individual being, definitely they will now understand their seek role, and they will be seeking the confirmation from the family or friends, so that they will also understand or recognize their changes or the pathological changes that has been taking place in an individual being. Now they definitely get excuses from normal duties and responsibilities in this stage if the signs and symptoms are severe enough. Also in this stage, basically the client will be capable enough to decide whether they need a medical treatment, or what are the basic things they have to follow in order to minimize signs and symptoms and to prevent the disease process progression. So at the end of this stage of second, that is the assumption of seek role, a client will be definitely recognizing the importance to seeking the medical care. That's how we're going to see the stage of, or the next stage comes. The assumption of seek role result in certain physical as well as certain emotional changes. Here person may go for withdrawal, depression, even they will be going under certain physical changes where they will be not be able to perform their activity of daily living. Maybe they will be withdrawing with all other normal activities which they are used to do before, because definitely the assumption of seek role and the response towards it depend on what kind of symptoms the person is present with. Now depending on the changes, or depending on the psychological changes of the individual being, they may deny or delay the medical treatment seeking, or they may be very prompt to take or seek the medical treatment in order to minimize the disease progression. Now, it definitely depends on the client how they're reacting towards the illness. Depending on that, they may deny or delay, or they may be show a prompt action in order to seek the medical treatment. Now comes the stage 3, which is basically the stage of medical care contact. Now, at this stage, a client will recognize the changes that has been taking place. Now, definitely they will be seeking the causes behind the development of disease. They will also understood the importance to seek the medical treatment in order to cure the disease process. They will also here able or will be trying to understand the duration of illness, the complication of it, and the treatment procedure, and also they will be trying to understand the nature of illness. Now here, health professionals play the important role where they are basically examining, or they will be examining the client to identify the signs and symptoms. They will be collecting all the subjective and objective data through physical examination and history collection. They will be sending or suggesting the client to go for certain diagnostic studies, and ultimately at the end of this stage they will be able to conclude the diagnosis that what exactly the disease process the person is developed. More often the client here will be understanding the importance and they will be seeking medical treatment promptly, but in some cases we may see here in this stage, due to the fear and anxiety related to the medical treatment, some person would try to deny the presence of their illness or illness symptoms. So that's how the stage 3, where they are basically having a medical care contact, will either get a medical treatment done soon, or maybe they will be having certain fear, anxiety, through which or because of which they may deny to accept the medical care treatment. But soon often the medical professionals or the healthcare professionals and their family member helps them to counsel and get the idea regarding the importance to go for a particular medical treatment done in order to minimize the disease progression. Now comes the stage 4, where an individual being is convinced to get the medical treatment done for them, depending on the signs and symptoms and depending on the final diagnosis. Here they're going to accept the reality or fact of life. They're going to accept the diagnosis. They will be trying to understand the nature of disease, and here the client will be becoming dependent on the healthcare professionals mainly to get the treatment done. Here at this stage, definitely the client will be expecting care, sympathy and empathy, protection from complication development or disease progression. Now, next stage is the stage 5, which is the recovery and rehabilitative stage. Here, generally after the medical treatment, the client will be showing expected improvement in their health, and they will be basically changed to the normal stage or normal status of life as like before. Here at the stage, either the client will be regaining their original status of health, or else they might go for some complication and disability development where they need a continuous rehabilitative care support. Now, if the client is present with a chronic illness, they may continue with the treatment procedure, or if they have already developed certain disability, the client may need a rehabilitative care. So that's how basically a client, either they will be going into a recovering stage, or else they need a continuous rehabilitative support throughout the life. So that's how the 5th stage basically decides whether the client will be completely improved or whether the client will have to adjust with the changes that has been taken place because of the disease process. So as still here we have learned about the definition of illness, we have learned regarding the variables, that is the internal and external variables which is influencing the illness behavior. Also we have learned about the stages of illness behavior. I hope you understood how a person is basically responding towards the illness process and how the illness behavior is changing step by step, and they're seeking the medical treatment and they're achieving the recovery, or they are going for the rehabilitative care. So once we have understood this thing, I hope you are clear about the concept of illness. Now, as you understood the basic concept, so in the next session, we are going to continue about the discussion of impact of illness on individual, as well as we're going to read certain terminologies which include the acute, chronic, and terminal illness, which are very often used in a clinical practice. So thank you so much for attending the session. I hope you have enjoyed the session. So stay tuned for the next session.